Good afternoon, everyone. I'm Lisa Gallagher, National Cybersecurity Advisor for Chime. At the start of 2026, and for this Chime Cybersecurity Summit, we wanted to take a strategic look at the forces shaping healthcare security in the year ahead. As digital transformation accelerates and threat actors grow more sophisticated, including AI-driven attacks, we're challenged to think beyond tools and checklists towards long-term organizational resilience. Today's virtual summit focuses on strategy, exploring the threat landscape, governance, cross-sector collaboration, and the very intentional use of emerging technology to help us anticipate evolving threats, protect patient trust, and ensure operational continuity. Our goal is for all of us to gain the strategic perspective needed to lead confidently through 2026 and beyond. So welcome, everyone. And our first session is the threat outlook for 2026. Our speaker is Nitin Natarajan. He is a highly sought-after cyber consultant who advises public and private sector leaders on mitigating cyber and physical risks. As mentioned in his bio, he previously served as the Deputy Director of the U.S. Cybersecurity and Infrastructure Agency, CISA, from 2021 to 2025, and represented CISA in key domestic and international policy forums. For this session, we want to focus on strategic planning, as we mentioned. So Nitin and I are going to talk first about evolving threats, including AI. And then Nitin will share practical insights on looking beyond tactical mechanisms to building strategic resilience. Nitin, we're very happy to have you today for our opening keynote. Welcome.
Thanks, Lisa. It's great to be here with you and the team again.
Great to have you back. So first, as I mentioned, I'd like to talk about threat. There's so much going on in the world right now, and when we look at nation-state threat, which is, I think, something we don't always think about in healthcare, what patterns are you seeing and observing that you think will be really relevant and maybe intensify for 2026?
I think the big threat that we're looking at is obviously PRC in China, right? I mean, that's something that we've been dealing with for the
Right.
last several years. Doesn't mean the other key nation state threats, Russia, Iran, North Korea go away, but I think the focus as we look at 2026, needs to be the PRC and their activity, especially as we get closer to 2027 and beyond. We know that they've been investing a lot of time and resources into their efforts hitting all sectors, in healthcare specifically, being one of the key targets and making sure that we're able to kind of stay ahead of that. And I think the challenge is that we're asking, healthcare organizations, large and small, to protect themselves and defend against a nation state actor, which, frankly, even for the largest of organizations, is relatively unfair to ask of anyone, which is really why that collaboration, that public-private partnership really becomes essential. I think beyond the traditional four, as we look at other potential nations and actors, we are seeing a changing global geopolitical landscape. And whether we're talking about the war in Ukraine and other activities we're seeing around the globe, any shifts this year and into next year on that global landscape, runs the potential of causing actors to act up, and those that may have been on the margins, or those who may not have been as active, potentially acting up as well. And so, they're not necessarily going to have the same resources and strengths that we're seeing in the major nation state actors, but that potential exists, and it's something that we need to continue to prepare for.
So in terms of their tactics, right? What do we know about that? What are their threat, attack vectors? What are their tactics? And then what are they going after in terms of healthcare? Is it infrastructure? What is it?
So it really is a combination. I like to look at this as the changes that we're seeing in the adversary landscape and the victim landscape. So if we look at our adversaries, obviously in addition to the key nation states, we're seeing that increase in cyber criminal activity across the globe, and we're seeing an increase in use of things like ransomware as a service and other types of capabilities. I kind of jokingly tell people, if you wanted to become a cyber criminal in the past, it was hard, right? I mean, you had to build expertise, you had to recruit, you had to have infrastructure, you had a way to move money and a lot of those types of things. Obviously, with things like ransomware as a service, you don't need that. You just need a target, and you need to be willing to give up a portion of your profit, and you can engage and play in the sandbox. And I think that change and that increase in what we're seeing in some of those spaces are going to make it a little bit harder. I think the other piece of it is not just the robustness of the adversary landscape. For me, it's that victim landscape that's changed as well. If we go back years and years, we never saw attacks against small and medium-sized businesses, right? We never saw attacks against K through 12 schools. We didn't see attacks against healthcare entities, right? They were somewhat protected. If we go back centuries of kinetic warfare, we never bombed tents with the Red Cross on it. We never impacted hospitals, right? They were treated as an entity that would be essentially above attack. Um, and we're not seeing that today, especially in the cyber landscape. We're seeing healthcare entities attacked. We're seeing small and medium-sized businesses attacked. We're seeing K through 12 schools that are being attacked. We're seeing individuals continuing to be attacked, especially seniors throughout the nation. So I think that change in that victim landscape as well is what makes me very concerned as we look into 2026 and beyond. If we look beyond that into things like cybercrime and the increases in cybercrime, when we look at the healthcare sector, at least going back to data from 2024, the healthcare sector was one of the top hit sectors when it comes to cybercrime here in the United States, impacting, I think it was about 16.6 billion that year of reported cybercrime. And depending on who you talk to, they'll say, about 5 to 10% is what we see as being reported. So that increase in cybercrime, the change in those victims of cybercrime, obviously the utilization of AI is making it easier for adversaries. It's making it easier for defenders as well, which I think is a plus. But it's also making it easier for adversaries. And also looking at those vulnerabilities that we're seeing from the implementation of AI. I'm not anti-AI by any means. AI is a wonderful tool. It's really going to change the landscape. But there's a lot of people jumping into AI without their eyes wide open. And I think there are vulnerabilities being introduced into different sectors by implementing AI, frankly, too fast and not really understanding the vulnerabilities that you're bringing into an organization. We're also seeing, as we look at the healthcare space, an increase in places like long-term care facilities and nursing homes and assisted living facilities. A lot of seniors are being attacked as well. When we look at the age breakdown of groups that are being attacked for cybercrime purposes, those 60 and above are in the largest group, and they had the largest increase of any age population in attacks transitioning from 2023 to 2024. And we continue to see those types of impacts happening. We continue to see those impacts, with basically threats and convincing folks to go out and buy Bitcoin or to essentially divest their entire life savings. And it's happened to individuals. And I think we're going to continue to see more of that because it's effective. Right? We're going to continue to see that because people are making millions and billions of dollars by conducting these types of attacks. And I think that's the part that concerns me, is that we're still seeing success in these areas, which is why we're still going to continue to see these attacks.
So I hear you saying we continue to see cybercrime as a motivator. I wanted to ask you a question I get a lot, which is in terms of the nation states like China, there's a lot going on politically, globally, right? So in terms of geopolitical motivators, do you see countries like China, having other motivators for healthcare as a critical infrastructure? Or are you seeing them have any motivators along that in those regards? And also, are you seeing things like APTs, advanced persistent threats, where they're in networks of organizations in various sectors? I don't know, maybe lurking and planning and scanning, so we all, I think, understand the crime aspect. But because of all the politics, we often wonder what is the implication in terms of, the geopolitical threat.
I mean, I think we continue to see, obviously, there's the traditional nation state activities regarding espionage and those types of things, right? Those have been around for a long time. Those will continue. I think the thing that we have seen over the last several years, I'm sure everybody's tracking, is the living off the land techniques that we're seeing from the PRC, which have no value in espionage, right? Frankly, it's not about cyber crime. It's not about any type of monetary impact. It truly is about pre-positioning on critical infrastructure across the United States with the intent of essentially activating those capabilities at a time of their choosing to impact our ability to conduct defensive operations, or frankly, just our ability to to conduct our day-to-day business. I think that living off the land, that pre-positioning on critical infrastructure networks, to me, is one of the things that's highly concerning as we look at pre-positioning on, things like the energy sector, telecom, and others. But frankly, one could easily make a case on why pre-positioning on healthcare and the healthcare sector would be valuable as well, right? To disrupt that day to day. Also, looking at the impacts of that on trust. I think, people traditionally went to healthcare institutions with a high level of trust. It's where you went when you were sick, when you were injured, when you needed assistance. And if these types of activities, these types of attacks impact that type of trust, you do have a societal impact at the individual level. And I think that's what some of the adversaries are looking to do, again, at a time of their choosing. So making sure that we're able to protect against those, we're able to identify when those types of attacks are happening, we're able to identify when they're on networks and able to evict them successfully, really is critical. And I think those are the types of activities that I want to make sure folks understand are being seen across the nation. And again, these have no traditional espionage value, they have no monetary value. It truly is about disrupting the life of day-to-day Americans, and healthcare is a sector to help accomplish that mean as well.
So if that geopolitical threat is manifesting across sectors, it seems to me that in healthcare, we should be paying attention to what's going on in other sectors, maybe communicating with them. I mean, how do you advise we do that, especially given the, staffing situation at CISA and some of the challenges governmentally? Like, what do you advise the healthcare sector in terms of cross-sector lessons?
So I think there's a lot of lessons to be learned out there. I mean, when we look at where healthcare was when I started a lot of this work in 2006, 2007, 2008-ish, I felt that we were trying to sell the cybersecurity to healthcare, right? I mean, there were people out there doing the work. I don't want to say that it wasn't there, but to really understand cyber risk at the CEO level, at the board level, to have that type of engagement, to really understand that cybersecurity is part of enterprise risk was an uphill battle. And it was an uphill battle for every CISO and every healthcare organization around the country. But it was a battle for us and the federal government to try to have these conversations to get us on the map. Those were things that back then sectors like the financial sector and others weren't facing, right? They were able to quantify the return on investment for cybersecurity. So we saw strong investment in those areas. And I think that we have gotten past that now. Right now, we are having active conversations among CEOs, boards, and others about why cybersecurity is part of enterprise risk. I think there are continued lessons to be learned as we look at some of the other sectors. The energy sector, for instance, has done a great job of integrating their cyber response in their overall organizational response. So they don't treat, many of those organizations don't treat cyber response as a separate entity for their CISO and for their IT teams to handle, but really look at it as an organizational response of how do we bring in our communications capabilities, legal, others, to really have that robust organizational response to that incident, regardless of what caused it, natural disaster or some type of a cyber attack. So I think there are always lessons to be learned from the other sectors. I think it's why engaging locally, regionally, and nationally, and frankly internationally, with partners across all sectors, really is critical. And frankly, the converse is true as well. I think there's a lot that other sectors can learn from healthcare organizations, from the work that's been done over the last number of years, and to be able to share those messages and to share those successes, to share the challenges as well. One of the sectors for me that's on the horizon has been food and agriculture. How do we, as we look at the increase in technology in a lot of our food and agriculture sector, how do we help them prepare? And frankly, they're where healthcare was years ago, of trying to convince organizations that this needs to be a priority and something to look at. And I think it's an area where the healthcare sector can help share that message and again, help share the successes you've had to help in other sectors continue to grow and build their cyber resilience.
Right. Well, thank you. I'd like to move to the nexus of AI and cyber. 2026, I think that's a lot of what we're going to be talking about, AI. And, both as a vulnerability and as a defensive tool. For healthcare, I know that you frequently talk about deploying AI with intent. So what does that mean for us in healthcare?
So I started talking about deploying AI with intent about a year ago, and to me it's dual-sided, right? So it's for those organizations that are developing AI tools and selling AI tools to be very transparent about the tools themselves, about how AI is being utilized within the tools, what it means to have an AI-enabled tool, how the tools are trained, what happens with data that's in the tools, how are they protected, what is shared, what isn't shared, and really having that type of transparency. The flip side is for those of us who are utilizing AI capabilities to buy within and have that intent when we're purchasing and bringing technology into our organizations. Again, similar types of questions. Do we know what's happening with our data? Do we know how the models were trained? Do we know what they mean by AI enabled? And I think I was at a conference earlier in 2025, and I talked to a lot of the vendors that were selling AI tools. And I said, tell me more about your utilization of AI in your tools. And the answer I got was it was going to save you time and it was going to save you money. I said, well, that's great. However, tell me more about the tool. And often the response was, it's going to save you time, it's going to save you money. They weren't able to have that conversation to really understand how AI was being utilized within the tools and services that they were selling. And I think those are the types of questions we need to ask more of to have that transparency of those that are selling tools and those that are buying them. And that's what I mean when I talk about deploying it with intent, is that we're not just using AI to say we're using AI, but know how we're using AI, how it's impacting our organization, how we're maintaining privacy, how we're able to accomplish our means more effectively. And frankly, sometimes it is cheaper and it is faster, but doing it in a way where our eyes are wide open.
So, I guess then in terms of governance frameworks, what do you recommend that organizations do or use? What frameworks should they use, and what should they put in place now to manage AI risk?
So I think there's a few things. I mean, we know with AI, at least from as we look at the cyber attack perspective, right? It's going to help our adversaries with speed. It's going to help them with complexity. It's going to allow more people to jump into that adversary space beyond kind of traditional ransomware as a service and those types of elements. So I think, when I talk to organizations about things that they can do, one is what we talked a little bit about is deploying AI with intent. The other part is really doing that deep due diligence and knowing what you're buying within the organization, know how that's integrating into your networks and your systems, knowing how effectively how your systems are connected and what other data it may have access to. And the other piece really is knowing how your employees are using AI. As I talk to organizations, one of the things I've seen and heard from is organizations that are not uh, formally deploying AI within their organization, the employees are using it, right? The employees are using AI to make their jobs easier, and sometimes they're doing that safely, and sometimes they're doing that by not entering PII, not entering corporate sensitive information or plans into these more public LLMs. And in others, they're not, right? They're not either aware of the potential security implications in some times maybe they are aware, but they don't see it as a true issue. I talked to an organization that I talked to a conference where there was somebody in the audience says, well, we wanted to help streamline our emergency response plan, so I just uploaded them all into ChatGPT and said, do X or Y. And I said, well, what happened to all that information that you uploaded? How else could that be accessed or used? And there wasn't that thought process of uploading all of our internal emergency management, emergency operations plans into a public LLM wasn't going to cause potential issues down the road. So really understanding how your employees are using it, and then how can you help them use it in a more safe and effective manner, coming out with guidelines and recommendations on actions that they should and should not do, and then enforcing that, which I know is not the easiest thing to do. We see that in the education system, especially. But finding ways to do that, I think, are crucial things that we need to look at as we talk about AI deployment within organizations.
Yes, I think that we sort of term as shadow AI, right? It's out there, it's being used and really not managed by the security function or the organization in terms of risk. So in terms of shadow AI and also something I call embedded AI, which is something that comes along with a vendor product that you bought, maybe implemented in a version update, but there's actual, AI that's being used in that product and may be accessing your data. So in terms of anticipating that and governing both embedded AI and shadow AI, I mean, what do you recommend? I mean, I think maybe a first step is awareness that these things are out there, right?
Yeah, I think it is that awareness element of making sure that individuals within the organization truly understand this. And it's not about educating CISOs, right? CISOs are well aware of this. They've been tracking this. They're extremely knowledgeable about this. It's engaging management in the
Right.
non-technical space. It's engaging, frankly, every employee and making sure that they're aware of how these tools are utilized and what how they could be used for nefarious purposes. And it's all part of that employee education. And I think, integrating it into that education, frankly, along with, how not to become a victim of cybercrime, how not to become a victim of these other types of attacks, really is essential. And ensuring that folks understand that this is not just about their workplace, right? I mean, these are steps and tools and questions they should be asking in their personal use of AI solutions and their personal use of technology. And so it really does help the individual employees both in the workplace, but also helps them personally to help kind of build their cyber resilience against these actors.
And you think maybe policy change in some areas?
Yeah, I think policies are helpful. Again, but to me, policies are helpful if they're enforced and if folks are
Right.
educated on them and they know how to use them. I mean, I remember when I was in the hospital, clinically, we had to do annual testing. Things were in a binder. They were in the on the bookshelf. You took them out, you did your answers, and things were lightly penciled in. And whether people truly spent time on that, I don't know. And making sure that whatever training you do, whatever implementation you do for policies and for those types of things are effective and are really making it down to the user level and in a way that it resonates with them, that encourages them to actually take the actions that they need. I mean, I think writing, policies and rules and regs and all those elements are great, but to me, it comes down to the actual implementation and is it changing behavior and is it causing people to take safer actions in their day-to-day work?
So Nitin, I'm going to pause here because we have a couple of audience questions and they're related to AI. So before I move on to the next category, first question, should healthcare be even more concerned about PHI security as AI features are becoming more native even on like Windows OS? And are vendors looking at this as well?
I hope vendors are looking at this as an
I think
element.
so too.
I think when it comes to PHI, I mean, my concern is when we look at some of the crime statistics, right, and we look at some of the value of PHI on the dark web, for instance, right, is much more valuable than social security numbers. It's more valuable than driver's licenses. It's more valuable than credit card information, right? I mean, it's 2 to 3 times the cost of value of credit card information. So I think people are looking to get access to that. So really understanding where PHI is located, how it can be accessed, and what those vulnerabilities are really are key. I'm hoping vendors are looking at that as a key element of it. But again, this is where I think buyer beware. Asking those questions when you're looking at implementing new technology really is key as well. And it goes back to Lisa, as you mentioned, that implementation of education at all levels of the organization so that you're able to acquire software that truly is secure in protecting your information.
We had a question about cultural changes with regard to AI adoption. I think you covered a lot of that, but it's mostly educational. But in terms of overall culture, do you think it's a culture shift or just more awareness in terms of, the implementation of AI?
I, I think it's both. I think we do need to look at changing the culture. And I know a lot of folks I've talked to have said, this next generation is very cyber savvy, so we don't have to worry
Right.
about the Gen Zs and stuff as much. And I would offer that and I offer this. I'm biased. I have 2 kids in their early 20s, so but I'd offer when they were in high school, they weren't cyber savvy. They were tech savvy. And I think we're conflating the two when we talk about kind of the next generation. And I've talked to a lot of groups where, folks in Gen Z, frankly, have made comments to me like, we don't care if our personal information is out there. I don't care if my credit card information gets lost or hacked because there were safeguards in place by financial firms to help protect me from that information. I don't care about my social security number being protected as much as, you know, your generation does. So there's also
Yeah,
kind of the
it's out
shifting
there.
perspective on what is personal information, how should it be protected, and just not caring as much, which is frankly, as they come into the workforce, is the
Yeah.
culture that they're going to bring in the workforce. So changing that culture within the organization on why it's important really is critical as well.
Okay, I'm going to move on to our final area of conversation, and I apologize. There's a couple of questions we didn't get to, but I think you covered them in some of your conversation, so I'm okay with that. Talking about, wrapping this into overall strategic organizational resilience. Um, what are the most critical risks to like other things like the digital supply chain and things like that that we have to worry about? And how does that get wrapped into strategic organizational resilience? And any other thing that you think, we mentioned cross-sector collaboration. What does, overall strategic operational resilience look like this year, looking ahead?
But I think I look at it as really one of the macro things I mentioned earlier, right, is integrating that cyber response and the cyber preparedness in the overall organizational response. And so whether we're talking about preparedness and integrating it into enterprise risk and looking at this as you would other corporate risks through the actual response and integrating that into your organizational response capability. It's making sure our CEOs and our boards are engaging on cyber preparedness matters and not just saying our CISO is handling this, I don't have to worry about it, right? But asking those questions, empowering our CISOs, and investing in our CISOs. I know investment in the healthcare sector is a challenge at times. Margins are not high in across the sector. But making sure that you are making that strategic investment in a way that is supportive of that security posture. I think also having eyes wide open on what you're not investing in, right? We'll never mitigate all risk. We'll never invest all the money we need to. But being eyes wide open on where we're not investing and understanding the risks that come with that, right? We accept risk in our organizations every day. We have to. It's part of what organizations do. But integrating that risk and understanding the risk that you're accepting in your organization really is key. I talk about risk as a three-legged stool. We spend a lot of time on risk identification, risk mitigation. We forget about risk acceptance. And if we don't,
After,
if we, identify it and we don't mitigate or can't mitigate it, we're accepting it. And we need to know what risk we're accepting within our organizations. So I think that there's always more that can be done there. I think as we look at engagement with groups like the ISAC, like the Health ISAC, federal government agencies like CISA and FBI, even though we're seeing obviously staffing levels continuing to change, fusion centers are doing more locally on cybersecurity. There's a lot of regional groups that have been stood up that are cross-sector, some that are within the healthcare sector, others that are more cross-sector. We're seeing states and National Guard units stepping in more in the cyberspace. So I think that there's a lot of engagement opportunities for organizations locally and regionally within the healthcare sector, and making sure that your organization is engaging at that local level really is essential as well. So I think those are steps that organizations can take as we look at 2026 if you're not already engaged to do so. And I will just say real quick, I mean, the supply chain risks continue to be high. We're seeing a continued dependence on technology in our supply chain work. Even if you look at things like healthcare distribution and compliance with DSCSA and other types of legislation, right? I mean, these are dependent upon technology in order to comply with some of these rules and regs. And what does that paper, backup look like and resorting to paper? So I think as we look at 26, it really is integrating that cyber awareness and defense into the overall culture. It's making sure you have the right manual backups and that ability to go back to paper, as they say, which I'll just make a quick plug. I mean, everyone says it's easy, but clinicians today weren't taught on paper. When I was in the hospital, we learned on paper and we went kicking and screaming into electronic systems. Today's clinician has never learned on paper, right? So there is a training and education aspect to this that flipping back to paper isn't as easy. I've talked to health clinics around the country that have said their patient engagement times and charting times have gone from 5 to 10 minutes to 40 minutes per patient. And how do you account for that as we look at some of our manual backups in the event of some type of a cyber incident?
right. So I have one more participant question, which I think is a really good question, and it shows people are really thinking about strategic resilience, right? At what point does a hospital ransomware attack cross from a cyber crime into a national incident? And how do we have do we have a clear trigger for federal intervention? How does AI security assistance startups like his company, participate in federal programs? So really, like if a healthcare organization has a ransomware attack, how do they know they need to notify others and maybe trigger something or give enough information that it can be determined that it may be a national level incident? And that's really, thinking strategically above and outside their own organization.
Yeah, I mean, I think this is why cyber incident reporting is so critical. And that voluntary reporting is key. I mean, it's why we pushed for cyber incident reporting for so long, right? And I think the issue at CISA was we didn't want cyber reporting purely as a means of data collection. And I think a lot of people perceive cyber incident reporting as a means of data collection. There is a
Right.
value of looking at data and understanding what we're seeing. The value of cyber incident reporting really is allowing the federal government to engage and to look at how broad that attack may be, both within the healthcare sector and more broadly beyond that, to work with partners in the intelligence community and frankly partners around the globe to understand what we're seeing, to be able to work with the manufacturer or developer of that software that might have the vulnerability, to be able to identify what the mitigation steps are, and then to get that mitigation back not just to the victim, but frankly to everybody else in the sector or the sectors that could also be potentially impacted, right? How to hunt for this, how to mitigate it. And so that incident reporting really is essential in helping identify the issues and then to go back and help the broader community that might also have to respond to that type of an incident.